Margaret walked into my clinic last spring, 68 years old, complaining of severe bone pain and constant fatigue.
Bone pain? In Japan, we'd first ask about sun exposure and diet.
I ran her labs immediately. Vitamin D levels were perfect on paper. Actually, too perfect.
Too perfect? What does that even mean?
She'd been taking 10,000 IU of vitamin D daily for 3 straight years. Her calcium levels were through the roof.
And let me guess, her doctor recommended it?
Recommended? No. She read an article online about bone health, bought it herself, never told anyone.
This is the problem with supplement culture. People think more equals better.
Akira. Margaret's kidneys were forming stones. Her arteries were calcifying. This wasn't philosophy, it was toxicity.
I'm not disagreeing. I'm saying, why was she taking it in the first place?
Because vitamin D deficiency is an epidemic in the elderly. But here's what nobody talks about. Margaret's case wasn't unique.
How common is this, really?
1 in 3 seniors I see is taking supplements that could be harming them. Not helping, harming.
Wait, there are more dangerous vitamins?
5 vitamins, 5 common mistakes. And by the end of this, you'll understand why Margaret almost didn't make it.
So let's talk about vitamin D specifically. What's the safe dose?
The recommended daily amount for seniors is 600 to 800 IU. Margaret was taking 10,000.
That's more than 12 times the recommendation. How does this even happen?
Because online influencers sell fear. They say standard doses don't work. They push megadoses without medical supervision.
In Japan, we encourage 15 minutes of morning sunlight. Natural synthesis. No pills necessary.
That works if you live in Okinawa. But in Seattle, Boston, 6 months of winter, people need supplementation.
Fair point. So what happens when someone like Margaret overdoses?
Hypercalcemia. Too much calcium in the blood. It pulls calcium from bones and deposits it where it shouldn't be.
So the vitamin meant to strengthen bones actually weakens them?
Exactly. Her bone density scan showed early osteoporosis. She started the supplement to prevent that exact condition.
This is what I mean about balance. The body is not a machine you can hack.
Agreed. But here's where it gets worse. She was also taking calcium supplements, 2,000 milligrams daily.
Wait, calcium is the second vitamin on your danger list?
Number 2. And this shocks most patients. Everyone thinks calcium equals strong bones. End of story.
In elderly care, we see this constantly. Women, especially after menopause.
Studies show calcium supplements above 1,000 milligrams daily increase heart attack risk by 30% in seniors.
30%? Robert, I need you to explain the mechanism here.
When you take calcium as a supplement, it floods your bloodstream. Your body can't process it efficiently. Deposits form in arterial walls,
creating atherosclerosis, hardened arteries.
Correct, but when you get calcium from food, leafy greens, dairy, fish bones, your body absorbs it slowly.
This is exactly what traditional Japanese medicine teaches. Nutrients from food come with cofactors.
I don't usually say this, Akira, but you're absolutely right. Margaret's supplement was creating the problem she feared most.
Heart disease.
Her coronary calcium score was through the roof. At 68, she had arteries of an 85-year-old.
So vitamins D and calcium, both meant to protect bones, both causing serious harm when misused.
And we're only at number 2. The next 3 vitamins are even more dangerous.
What's number 3?
Vitamin E, the so-called heart health vitamin. Margaret was taking 400 IU daily for 8 years.
Wait, vitamin E is an antioxidant. How can an antioxidant be dangerous?
Because in high doses, it acts as a blood thinner. Most elderly patients are already on blood thinners.
So you're creating a compounding effect.
Exactly. A major study followed 29,000 men taking vitamin E. Hemorrhagic stroke risk increased by 22%.
22% increase? That's catastrophic. Why isn't this common knowledge?
Because the supplement industry is worth $50 billion in the US. There's no incentive to publicize risks.
In Japan, supplements are regulated much more strictly. You can't buy high-dose vitamin E without pharmacist consultation.
I wish we had that here. Margaret came to me with unexplained bruising. bleeding gums, minor cuts that wouldn't stop.
Classic signs of excessive anticoagulation.
She didn't connect it to the vitamin E. Nobody does. They think vitamins are harmless.
Arsenic is natural too. Hemlock, nightshade. Natural doesn't mean safe.
Perfect analogy. Now let's talk about vitamin K. This one's tricky because it's the opposite problem.
How so?
Vitamin K helps blood clot. If you're on warfarin, which Margaret was, vitamin K completely counteracts the medication.
So you're taking a blood thinner and a blood clotter simultaneously?
Exactly. Her INR levels were all over the place. 1 week too thin, next week too thick.
This is incredibly dangerous for someone with atrial fibrillation.
Margaret had AFib. She was at stroke risk. The warfarin was supposed to protect her, but the vitamin K sabotaged everything.
Wait, she was taking a multivitamin too?
Most seniors are. 50-plus formulas. They all contain vitamin K. She had no idea it was interfering.
So someone with good intentions is actually sabotaging their heart medication.
Precisely. And Margaret had been doing this for 3 years. Any day she could have thrown a clot.
Stroke, pulmonary embolism, deep vein thrombosis.
All because of a multivitamin she bought at the grocery store. No prescription, no warning label.
This is why I always ask my patients what supplements they're taking, not just medications.
Most doctors don't. That's the problem. We're trained to ask about prescriptions. Supplements fly under the radar.
So we've covered 4 dangerous vitamins: D, calcium, E, K. What's the 5th one?
Vitamin A. And this one, Akira, this one almost killed her.
Vitamin A? The vision vitamin? How is that dangerous?
Because unlike most vitamins, vitamin A is fat-soluble. It accumulates in your liver. You can't just pee out the excess.
So it builds up over time.
Exactly. Margaret was taking a multivitamin with vitamin A, a separate eye health supplement, and eating liver once a week.
Liver is extremely high in vitamin A.
She thought she was being healthy. Organ meats, supplements for her eyes, all recommended by wellness influencers.
And what happened?
She came to the emergency room with severe nausea, dizziness, blurred vision. Her liver enzymes were 8 times normal.
Hepatotoxicity, liver poisoning from vitamin A.
We ran a vitamin A level. It was through the roof, 10 times the upper limit of normal.
Robert, that's potentially fatal. Did you hospitalize her?
For 5 days, IV fluids, complete supplement cessation, liver function monitoring every 6 hours.
And she recovered?
Eventually. But here's what haunts me. If she'd waited another week, permanent liver damage, cirrhosis, transplant list.
All from vitamins she thought were helping her.
That's the tragedy. She was trying to be proactive, taking supplements, eating nutritious foods, doing everything right.
But too much of a good thing became poison.
Exactly. And the worst part? This isn't rare. I see vitamin toxicity cases every single month.
Every month? Robert, that's an epidemic.
It is. But nobody's talking about it. Supplements aren't regulated like medications. No prescription needed. No dosage limits.
In Japan, we require doctor approval for any supplement over certain thresholds.
We need that here. Margaret walked into a pharmacy and bought enough vitamin A to damage her liver.
So let me summarize. 5 vitamins. D causing kidney stones and bone loss. Calcium causing heart attacks.
E causing hemorrhagic strokes. K interfering with blood thinners.
And A causing liver failure. All vitamins people take to stay healthy.
Now here's the question everyone's thinking. Should we stop taking supplements altogether?
That's not the answer either. Some people genuinely need supplementation.
Agreed. The key is knowing when and how much. Let me break down the safe approach.
I'm listening.
First rule, food first, always. Before you reach for a supplement, ask yourself, can I get this from diet?
This is fundamental in Japanese preventive medicine. Food contains nutrients in balanced forms.
Right. Spinach has calcium, but also magnesium and vitamin K to help absorb it. Nature creates balance.
Supplements give you isolated compounds. No cofactors. No synergy.
Exactly. Second rule, test before you supplement. Don't guess. Get blood work.
so you know if you actually have a deficiency.
Margaret never tested her vitamin D levels before starting megadoses. She assumed she was deficient. She was wrong.
How much does testing cost?
Vitamin D test? $50. Potentially saves you from kidney stones, heart disease, bone loss. Worth it.
And if the test shows you are deficient?
Third rule, use the lowest effective dose, not the highest, not what the bottle says, what your lab results require.
And retest periodically to make sure you're not overdoing it.
Every 6 months minimum. Your needs change. Your body changes. What worked at 65 might be toxic at 70.
This requires medical supervision, though, not self-prescribing from the internet.
Exactly. Fourth rule, tell your doctor everything. Every supplement, every vitamin, every herb.
Because interactions are the most dangerous part.
Margaret's vitamin E and warfarin interaction almost caused a brain bleed. One simple conversation could have prevented it.
Most patients don't think to mention supplements. They only list prescription medications.
That mindset needs to change. Supplements are drugs. Just because you don't need a prescription doesn't mean they're safe.
What about multivitamins specifically? Are they safe for seniors?
Here's my honest answer. Most seniors don't need them. If you're eating a varied diet, you're fine.
But the marketing says 50+ formulas are essential.
Marketing, not science. The only seniors who benefit are those with documented deficiencies or malabsorption issues.
Like after bariatric surgery, or with inflammatory bowel disease.
Correct. Those patients need targeted supplementation under medical supervision. But the average healthy 70-year-old eating balanced meals? No.
In Okinawa, centenarians don't take supplements. They eat 7 different vegetables daily. Fermented foods. Fish.
And they're the longest-lived population on Earth. That should tell us something.
Food contains thousands of compounds we don't even have names for yet. Phytonutrients. Polyphenols.
Exactly. When you isolate one vitamin and take megadoses, you're disrupting that natural complexity.
So what happened to Margaret ultimately? You said she recovered.
We stopped all supplements immediately, waited 6 weeks, retested everything. Her kidney function improved, calcium score stabilized.
And her liver?
Took 3 months to normalize. Liver has remarkable regenerative capacity, but she was lucky. Another month and we'd be talking transplant.
Is she taking any supplements now?
Just one. Low-dose vitamin D, 800 IU, because she tested deficient after we stopped everything, under my direct supervision.
And she gets regular blood work now?
Every 3 months, we monitor everything. INR for her warfarin, vitamin levels, liver function, kidney function.
That's the level of care everyone over 60 should have when taking supplements.
So here's my final advice. If you're over 60 and taking any of these 5 vitamins, schedule an appointment with your doctor this week.
Bring your supplement bottles. Get blood work. Because the vitamins you think are saving your life might be the ones slowly taking it away.